Dr. Lee Green, thank you so much for being with us today and doing this remote interview. The reason we are doing the interview remotely is because, of course, we're in the middle of this pandemic. How have different racial groups been affected by COVID-19?
Yes, that is a great question. First of all, thank you so much for having me. African Americans, Hispanics, and other minority groups have really been impacted in a significant way by COVID-19. And we know that the reason why we have these increased deaths because of COVID-19 is that these populations tend to have higher rates of heart disease, diabetes, obesity, cancer, etc. And those are long-standing disparities that have been going on in these communities for a very long time. So it has had a significant impact on these communities.
So it sounds like you're not surprised.
No, not surprised at all. Not at all.
What are some other alarming health outcomes that we may not be aware of?
Great question. I think there are several that I wanted to bring to light. One is prostate cancer in Black men. That is a major disparity that we see on a day-to-day basis. Black men are 2 times more likely to be diagnosed with prostate cancer, and unfortunately, 2.5 times more likely to die from prostate cancer. And so we have folks at the Moffitt Cancer Center who are working each and every day trying to address that disparity, trying to figure out why we have these different rates and why we have Black men who die more frequently from prostate cancer compared to other populations. Another probably common disparity is around breast cancer in Black women. So what's interesting about that one is that white women tend to have a higher rate of breast cancer, but it flip-flops in that Black women die more often from breast cancer. And so you wouldn't normally see that. If it's a higher rate, you would also think that there would be a higher death rate. In this case, it flips over. And so at some point in the timeline, Black women end up surpassing white women as it relates to death from breast cancer. And I can tell you that the primary reason is later diagnosis. So even though there are higher rates in the white community, Black women tend to be diagnosed with breast cancer at a much later stage. So if you're diagnosed at a later stage, that means that your outcomes will probably be worse.
Wow. Wow, that's pretty sobering.
Yeah.
I wanted to ask you another question about the pandemic that we're in. A lot of my Black friends have joked that they don't want to be the first person in line for the COVID-19 vaccine. And it's partially funny, but it's partially based in history. What is the reason why the Black community is often skeptical of healthcare systems?
Yeah, another great question. And we hear a lot about a lack of trust around the healthcare system, in terms of participating in clinical trials and research studies. And we hear a lot of people talk about the U.S. Public Health Service syphilis study at Tuskegee. And you're wondering, where did that name come from? Because most people call it the Tuskegee study. The Tuskegee syphilis study. But, one of the things that we did, I was a part of a panel back in the mid-90s that looked at an apology for the men who participated in the syphilis study. And one of the things that we did was we wanted to change the name of that study from Tuskegee syphilis study, which when you hear that name, it sounds like it was Tuskegee who conducted the study, when in fact it was the U.S. Public Health Service syphilis study that happened at Tuskegee. So I just wanted to make that clear. But many of your viewers may know that there were 400 Black men who had syphilis who went untreated for almost 40 years. I think it was 1932 to 1972. And the researchers wanted to see the effect of untreated syphilis on the human body. So they used these Black men to try to answer this question. And of course, the men had no idea that they were being used in this way. And so when people think about participating in a clinical trial or a research study, their minds go back to that horrific study that happened in Tuskegee, Alabama. And so people, certainly have the right to be skeptical of participating in, clinical trials, research studies. As you pointed out, they will need people to participate in the vaccine trials for COVID-19. And what I will say to the minority communities who are skeptical is that there are safeguards in place today that will prevent a Tuskegee from ever happening again. They have institutional review boards that look at studies, the ethical conduct of these studies, making sure that there is no way that people will be misused or mistreated in our research studies today. We also have where researchers have to go through trainings almost every year to make sure that they understand how to best conduct these studies in an ethical way. So there is no, and I said no possible way, it could always be a way, but it is very unlikely that we could ever see a Tuskegee study happening again. Last thing I'll say on that topic is it is critically important that we have a diverse pool of individuals who are participating in research studies. And the reason that is so important is that some of these therapies, some of these drugs may react differently in different populations. So if the only people who are participating in a study or a clinical trial would be white men, then the only thing we know is how that drug impacts their bodies. We wouldn't know how it affects Hispanics or Native Americans or Blacks or whoever. And so it's so important that we have those studies that are as diverse as we possibly can make them.
That's such a good point. Well, thank you for sharing that. And I know that the Tuskegee, Alabama experiment was just one example of many over hundreds of years, going back to even enslaved people being experimented
Yes.
on without anesthesia and just all kinds of horrors. So that's a little bit encouraging to hear from you. And we've diagnosed the problem of racial disparities in our healthcare system. How do we begin to turn that around?
So I think first and foremost, we have to provide the funding that is necessary to truly address disparities. There's a saying, no money, no mission. So if you don't have the adequate funding to address it, you're just not going to move the needle. We have seen this over the past month or so, addressing racism as a whole. We know that there are studies that have shown that racism exists within the health and medical field. We know that there are some populations that are treated differently compared to others. There are a lot of studies, and this is one classic example, that have looked at how pain is assessed when Black people go into the healthcare setting, that their pain may not be taken as seriously as when someone else from a different community comes in and complains about pain. So the clinicians have to really start to check themselves, have to understand if there is bias within their organization and bias in terms of how they treat people who don't look like them. Another issue that we have to deal with is overall access. Do minority individuals, do minority communities have access to the health and medical facilities that they need? And there could be a lack of access because of a lack of insurance. There may not be health and medical facilities in their communities, or lack of transportation to get there. So how do we make sure people have the access that they need?
Dr. Lee Green, thank you so much for giving us kind of a crash medical course in some of the health disparities among races. And hopefully this is the beginning of a longer conversation.
Absolutely.